Hello, I'm Margaret Gerald Cole. I learned about Dr. Patty through some friends I have at University of Central Florida, through some folks there, including my coach of the Tri-Nights, which is the triathlon team there. And some other folks had told me about her and said that great things about her, and I decided to come and see what she could do for me. I originally came to Dr. Patty because I was 48 and I was just starting to feel fatigued and just didn't feel as great about life as I used to. And I'm very active. I do triathlons, I'm an attorney, I do all of these things, but I just wasn't feeling as well as I used to. I know everybody has a busy life, everybody's tired, but this was a change in character, a different level of fatigue for me. I saw my general practitioner, my OBGYN, different folks, and I still wasn't feeling better no matter what I did, and so I came to her to try to enhance my health. My first visit was terrific. You know, this is a welcoming environment. I felt like everybody really wanted to be here, really wanted me to be here, and I spent almost an hour with Dr. Patty. We talked in detail about when does this fatigue happen, how long does it happen. We talked about how I eat and how I sleep, and just the whole picture instead of one little symptom or one little test. The first thing Dr. Patty helped me do was find and diagnose a rare disease. And part of the reason I was feeling this way was because I had a tumor on my pituitary gland. And your pituitary, I've come to find out through her and other people, really is your air traffic control center for your hormones and the rest of your body. So she did a lot of testing and sat down with me and said, this is not normal and you need to go straight to a neurologist and have this checked out. And we did, and I had neurosurgery. And after that, all of the things that you hear about that Dr. Patty helps folks with, mine came to a critical mass or crisis because I had no hormone production, no cortisol, no thyroid, no estrogen, none of the things that you hear about. And Dr. Patty, since that point, post-surgery, has helped me come from that bottom to where I am now. I've returned to my job. I'm starting to ride my bike. I'm starting to jog and, you know, look forward to when I can plan my next competitive event and things like that. I'm not sure when it would have been uncovered without me coming to Dr. Patty and having that blood test and the extensive review of my case that she did. And the consequence to that is decreased life expectancy by at least 15 years. So she helped me find this rare disease and increase my life expectancy. I have a very large, loving, very involved family, so everybody's in all my business in a very loving way. And all people say, they say, wow, I can't believe the change in you. You look great. You look like you feel great. You know, what are you doing and how can I get some of that? And I now have 4 generations of my family who are patients of Dr. Patty. I try to not be this zealot and say, oh, I know you really need to go see Dr. Patty, but I do refer her with no reservations to my dear, dear friends, to my sister, my grandmother, my mother, and even my son. You need to find somebody who can really partner with you in your health care to get to where you need to be and where you want to be. And that was hard for me to find someone, but when I did, I knew it. And for me, that was with Dr. Patty at SaJune Medical Center.